Glasgow Coma Scale is the most common scoring system used to describe the level of consciousness in a person following a traumatic brain injury. Basically, it is used to know the severity of an acute brain injury. The test is simple, reliable, and correlates well with the outcome following severe brain injury. During measuring the point, we need to look for eye-opening response, verbal response, motor response. For calculation of the GCS score, we need to see following points: eye-opening response, verbal response, motor response. First of all, eye-opening response. If the eyes are spontaneously open with blinking at baseline, we will give 4 points. Whenever eye opens after verbal stimuli, command or speech, then we will give 3 points. If the eye opens after painful stimuli, then we will give 2 points. If there is no response, then we will give 1 point. Now, verbal response. If the person is oriented, we will give 5 points. If the person is having confused conversation but able to answer questions, then we will give 4 points. If the person produces inappropriate words, we will give 3 points. If the person produces incomprehensible sound, then we will give 2 points. If the person is having no response, then we will give 0.1. Now, finally, we will assess the motor response. If the person obeys command for movement, you will get 6. If the person produces purposeful movement to painful stimuli, he will get 5 points. If after giving pain the patient withdraws his body parts, then we will give 4 points. If the person only flexes, he will get 3 points. If the person shows extension response after giving painful stimuli, he will get 2 points. If the person is having no response, he will get 1 point. Finally, after giving scores, we will assess the severity of head injury. If the person gets score 8 or less, we will call it a severe head injury. If the person gets 9 to 12, then we will call it moderate head injury. If the person gets 13 to 15, we will call it mild head injury. Thank you very much.